as we are looking at it, we call them as Norma, and based on how we are looking at it, we call them as Norma basalis, Norma frontalis, occipitalis, etc., etc. We learned about this Norma frontalis in the previous session. Now today we are going to talk about this particular views. This is what we have covered, right? Norma frontalis, frontal one we have talked about. Now on here we talked about few bones related to this particular Norma, like the important one for us is that frontal bone. We have to know the salient features of this particular bone and this maxilla, because one of the important thing related to the upper jaw, and these particular bones make some union which is related to this particular like a skull, like a bregma, we talked about it, and anterior fontanelle, which is a union point, which are like that union is not ossified at birth. We call them as fontanelles, anterior fontanelle and posterior fontanelle likewise. So this is we have learned in the session previous one in the frontal view. This is on the lateral view. So if you are looking at the skull from the sides, these are the views of the bones that you are seeing, like a part of the frontal bone, parietal bone, and the occipital bone, zygomatic bones, and as well as maxilla. Everything is visible out here. Will be just like a picking up one prominent bone out here is this particular bone, which is known as this bone as temporal bone. So this particular bone, you see that irregular shaped bone have got like many projections. Likewise, we call them as temporal bone. Now, if you look at this particular bone, you have to know a little detail about it. It's a widely complex bone. We do not have to know the general features of this particular bone individually, but having some features or having some parts, and you should be knowing like what are the external point, what are the like internal point, which is the superior side, which is the inferior side, and the internal features, which is clinically important to us. Now, this particular bone, as you are seeing here, separated out, the one which you are seeing in the pink shadow, we call them as the temporal bone. Now, this particular temporal bone can be divided on the parts. There are 4 parts are there, or some parts are there. So, that part which is expanded like this, we call them a squamous part. Now, this particular squamous part, if we go back from this side to this side posteriorly, we have a like a solid piece of bone which is present in the back side. We call them a mastoid part, or which is hanging behind the ear. So this is the back side which is dropping down from here, which is a solid kind of bone piece which is present. We call them as mastoid process. So squamous bone which has a lateral projections, we call them as zygomatic process, which is attaching with the zygomatic bone, cheekbone, forming with the arch, zygomatic arch. So this particular part which is like a projected backwards from this particular projections, which is zygomatic process, we call them as mastoid parts. This is squamous part. Now, these 2 parts are visible, and other feature which is there, this part which is going inside, going to this particular like a horizontally deep inside from this particular point, we call them as temporal bone or temporal part, which is going deep inside. So, deep to this particular opening, which is known as like external auditory opening, we have this particular temporal bone which looks like a plate. We call them as temporal plate, and then from this plate you can see that a spine like structure which is going out, right, looks like a teeth, skinny tooth. So this is known as styloid process. The styloid process is a kind of like projections which is projected down, just like mastoid process. Many of the bones, this particular bony prominence styloid process is skinny and snaps, breaks. So we do not see many of the bones have got styloid process intact in them. Very few of them are there, but we can see the part or like a separated styloid process there, just like a part of the styloid process which is attached to this particular plate or this particular tympanic plate, which you can see that in this particular bone. Many of them bones do not have them. So this styloid process is also having a part to it, and deep inside, if you just like cut the skull inside, we see a bone. This particular bone, temporal bone, have some parts which is uniting with these zygomatic bone. This is from the underside you are seeing here. This is the projections that we are referring here, styloid process. This is the mastoid process back side, and this is a squamous part which is present. This is a zygomatic process. So this piece you are seeing upside down, the skull bone you are seeing upside down, and this plate we call them as tympanic plate, TP, we call them as tympanic plate. Tympanic plate from going back, we have these particular projections. We call them as the styloid process. The styloid process is an important landmark thing that we have to know. And then if you remove this and cut these bones, you can see the cross section. We have a cross section view. Alright, so this part you are seeing that skull cut over here, and this particular skull, as you are seeing here, this is the jugular foramen. So inside out you are seeing this mid piece bone which is present in the midline, you call them a sphenoid bone. This sphenoid bone have a wing which is present anterior and posterior wing. Anterior which is small wing, posteriorly it is expanded, and this posterior wing we call them as great wing, we call them as less wing. This sphenoid bone which is midline bone which looks like a bat. So this particular bat has got wing, anterior wing and posterior wing. So this posterior wing of the sphenoid articulates with or joins with this piece of bone, as you seeing there. This piece of bone where we are rolling this cursor, this piece of bone is a part of this particular like a temporal bone. So this particular temporal bone, bone which has this part, we call them as this temporal bone which has got this part which is present, we call them as squamous Petrous part of the temporal bone. So this part we call them as Petrous part of the temporal bone. So this temporal bone can be divided into few parts. So this is externally you are seeing here squamous part, mastoid part, styloid process with this plate, tympanic plate, and this part we call them as Petrous part of the temporal bone where I am rolling it, joining with this particular sphenoid bone, we call them as Petrous part of temporal bone. So four basic parts of this particular bone is you have to identify. So whenever you are seeing this particular bone, you have to know that how to hold this particular bone anatomically. So this particular bone has got an external surface and internal surface. So this is what we are seeing here is external surface, and this is known as internal surface. External and internal can be identified by the presence of this foramen in here. We call them as external ear, that foramen is there, which is easy to identify. Now above and down is easy to identify by the squamous plate. The squamous plate should be above and this mastoid should be down. So this thing is like this. So this is above squamous part, this is mastoid part. Mastoid part is that part which you are feeling here. You feel this particular bone behind the ear, you touch a bone where this sternocleidomastoid muscle is attached to it. This is mastoid bone and this is what you are touching right now. So this is mastoid bone which is facing down, and this particular external ear should be outside laterally, and inside is this piece of bone that you are seeing here, right. So this part bone is known as, which you are seeing this piece, this one, we call them as Petrous part. P starts with P. So Petrous part of this bone, squamous part of the bone, and styloid process which is going down, and mastoid process which is on the back side. So these are basic four parts which is there. From the squamous part, again laterally we have a bone ejected. You can see that this is zygomatic bone or zygomatic arch which is going that zygomatic process. This is how we are going to identify. Now under this zygomatic bone which you are seeing here, zygomatic process, we have a depression there in front of this opening. So in front of this opening we have a notch. So this notch is for articulations of the mandible to make the joint. So we have this jaw joint making to the sides, and that particular joint we call them as temporomandibular joint. So if you are looking this particular bone from the side or lateral view, you see that this mandible is attaching, right. So mandible is attaching to this particular in front of this ear or external ear or opening of external ear, which is fitting in here. So this part of the mandible we call them as head of the mandible or condylar process. So which is making this particular articulations of this joint. So we call them as mandibular joint or temporomandibular joint. This temporomandibular joint have got two parts, anterior part and posterior part. Posterior part is articular, anterior part is non-articular. We do not have any bone related to this part. So which is lying under this zygomatic process. You see that this is a zygomatic bone, and joining here we have the zygomatic arch. So this particular zygomatic arch process which is making a horizontal kind of expansion, and under to it we have this particular like a mandible fitted in and making this particular temporomandibular joint present in here. So, this particular bone, if you are narrating it, having visible on the lateral view, temporal bone, have got squamous part, mastoid part, styloid process, and then we have this petrous part inside which is visible, and then we have this particular plate, we call them as temporal plate, which is present in here, which is deep to in this region running here and surrounding this particular opening which is present in this particular bone. So, in part of this narration, we have this particular bone which is temporal bone which has got features. So, identifying this particular bone, the name of this thing, and then you have to identify this above, down and medial and lateral. Once you identify them, you can place it in normal anatomical positions. So, this squamous part should be above, this opening should be lateral. So, this is laterally placed opening and squamous part. This we call them as petrous part of the temporal bone, should be directed medially. So, this is inside the brain and this is outside external. So, this is the external surface, this is the internal surface. This is above and this is below. Below by mastoid process. In front of the mastoid process, there should be a bony skinny notch. If it is visible, we call them as styloid process. So, which is present, and fartherly laterally confirmed by this particular bony piece, we call them as zygomatic bone arch, which is running here. Under this zygomatic bone arch, we find a depression where I am placing this finger. This finger is correspond to that particular temporomandibular joint fossa, where we have this TMJ joint formed, jaw joint. Now, temporomandibular fossa have got two parts, where the particular bone is fitting in, articular part, and in front of that non-articular part, which is not having bone contact. Then we have this bony opening of ear or external ear. This part is bony ear. Then we have this cartilage and this particular pinna, which is present in to the side. And then back side we have the mastoid process, which you can feel, which you can touch, mastoid process. Deep inside we have this, deep to this mastoid going down, we have this styloid process which is hanging down, which is also present on the lateral extreme. If you come into the medial side, this part of the mastoid bone we call them as petrous part. Now, petrous part which is directed or pointed part which is there, we call them as apex, and which is attached to this particular bone we call them as base. So, apex and the base, in between you have the body. Inside to it we have some foramens, we will be coming later about it. Now, this inner surface have got like some markings which is present to it because of this particular folds of the brain, sulci gyri, which is making some fold along with the meninges, which is present to this sides. Now, coming to some other salient features that we have to understand to this particular bone. So, this is what we are seeing from the lateral view. So, this lateral view exposes these particular different kinds of like bones which is making some sort of union. So, this particular union, as you seeing here, formed by this particular bone and along with this other bone, where you see that there are 1 bone, 2 bone, 3 and 4 of them are from inside. We have this particular sphenoid as well, wing of the sphenoid, making over here we call them as Pterion, this union point. We call them as Pterion, starting with P, Pterion. So, this particular union which you are seeing here, we call them as Pterion, which is present in this anterior extreme of this, the squamous part of the temporal bone, united with this particular bone, frontal bone. Then we have this like a sphenoid bone, we have this particular zygomatic bone coming into this particular place. Deep inside we have this parietal bone and the squamous part of the temporal bone, where making a joint. This union point we call them as Pterion, P starting with the spell with P with Pterion. Now, this particular Pterion is the weakest point of the skull. In an adult skull, this point we have a very weak point. So, if you have a trauma blow to this part, this particular point is very weak and have a chance of fracture. Now, fracture which commonly happens here, we call them as a depressed fracture. What do you mean by the depressed fracture? If you blow from outside, this particular bone go inside, and we call them as this kind of fracture as depressed fracture, because the bone surface goes down just like a pothole goes down. Now, at this particular Pterion, deep inside we have a blood vessel running, or present in this region we have related to a blood vessel. We call this as meningeal arteries which is present to it. So, this meningeal artery have got different divisions, anterior division, posterior divisions. the mid portions of the division, we call them as middle branch of or middle meningeal artery or middle meningeal vessels, is related to the Pterion. And as a result of this depressed fracture, this middle meningeal artery can get damaged and can create some kind of injuries to the structures related to it. What happens to it will come later on. But what is important to us to identify, what do you mean by Pterion, who forms this Pterion, and what structure related neurovascular or vascular structure is related to the Pterion, which can be damaged if you have a injury to that particular point. Now, why this particular Pterion is prone to have injuries? Because this particular part we have bones which is thinner, that is why it is prone to have fractures. Clear? So, Pterion is an important thing that we must know about the lateral view of the skull at this particular point. Opposite to the Pterion, we have another union. So, if you go to the posterior extreme of the squamous part, so this is the anterior extreme, right, the anterior side. If you go to the posterior side, you see that another union is there. Three bones are uniting there, parietal bone, occipital bone, and so is the squamous part. That union point we call them as Asterion. Starts with A-S-T-E-R-I-O-N, Asterion. This one we call them as Pterion, and this one is Asterion. So, the comparing with the Asterion with this Pterion is that Pterion is more prone to have a depressed fracture. Now, this particular depressed fracture proneness yields to have damage to the vascular structure related to it. What vascular structure is related to it? You have to remember the name of it. MMA, middle meningeal vessel, which is related to it, and that particular damage to this particular vessels leads to some consequences. So, we will learn later on about these consequences, but anatomy we will have to know this region first. So, this point we have to know about this clinical importance to this particular bone which is important to it. Then we have this zygomatic bone which is present. This zygomatic arch is also prone to have fracture if you have a lateral blow, but not to that extreme like Pterion. Pterion is the weakest one. So, next weakest point that is we have, which is horizontally running bone. So, if it is running horizontally, it is always against gravity which is growing. If you have a trauma, we have a chance of fracture to that particular bone as well. So, the zygomat fracture or cheekbone fracture is also a very common bone fracture that can happen if you have a blow to the face region. Next to that, we have this particular opening. What opening we have? Opening of ear. We call them as external opening of ear. So, that particular opening is guarded by the plate. We call them as tympanic plate. So, that particular tympanic plate is thin walled. That means it is made by some plates, like thin plates, and that particular thinness of the plate also leads to a chance of fracture or injury to it. Clear? So, that particular bone also present on the lateral extreme. So, if you have a trauma to the lateral side of the face, tympanic plate also can get damaged. Now, moving to that particular side which is even more posterior to it, this piece of bone, we call them as mastoid bone. Now, this particular mastoid bone, we have this mastoid antrum. If you cut this particular bone, we have a mastoid bone cavity exposed. That particular mastoid bone cavity looks like a corridor. That particular corridor is related to this middle ear. Now, that particular mastoid cavity inside, we have a hollowness there, just like we have these air sinuses we talked about, the paranasal sinuses. Similar to that, this particular mastoid bone outside it is tough shell, inside it is having some kind of hollowness there. So, we have some air sinus there as well. That means inside to it, it is pneumatic, that means air can be trapped inside. So, that air trapping area of that inside of the mastoid, we call them as mastoid antrum or mastoidal air cells. So, that particular mastoid air cells having present into this particular there, inside to it is a hollow bone. So, that particular mastoid air sinus can get infected because this particular mastoid or mastoid bone air sinuses are related to the middle ear cavity. So, inside the ear we have three parts of the ear. We call them as the external ear, which is visible and partly invisible. Then we have the middle portion of the ear, which is having the like a cavity, looks like a room, which is limited by this plate. We call them as like the membrane, tympanic membrane. And then deep inside, other side of it, we have a deep aspect of the ear. We call them as inner ear. So this middle ear, middle portions of the ear, mid portion of our ear has a communication through a duct to these mastoid chambers. Now, if you have an infection to the ear in the middle portion, that infection from the ear can travel to the mastoid and can destroy and create infection on the ear cells. So, that can lead to a clinical condition, we call them as mastoiditis. Infection of the mastoid, mastoiditis, right. So, that particular phenomenon is important to us. Other than this, this particular mastoid gives attachment to important muscle that we must remember. One is sternocleidomastoid. Another muscle present in front of the neck and moves back, slings back to the back side. We call them as digastric. The digastric have got two bellies coming from the digastric groove in the chin, then hanging down to this particular, makes a pulley with this hyoid bone, and then the reverse thing goes back, looks like a V, right. So, this V is coming from this below the mandible, going down and then moving back. So, this back side is anchored to this posterior belly, is anchored to this particular bone, which is also known as mastoid bone. So, this belly of digastric, which is projected backwards, posterior belly, along with the sternocleidomastoid is attached to it. This mastoid is a very important clinical part of this particular bone that will be asked in examination. So, besides this particular general parts of this particular bone, like what are the parts there, besides these anatomical positions, identifying these anatomical positions of this particular bone have got mastoid bone, and the significance of the mastoid bone that we have to know. What significance? Significance number 1, mastoidal ear cells is there, which is communicated with middle ear. So, infection from the middle ear can create the infection there as well, spread the infection there, that is one thing. Other thing, it has two muscles attached. One is digastrics, right? Good. In front of the mastoid, we have this opening of external ear. The external ear communicates with the middle ear through a canal. We call them as external auditory canal or external auditory meatus. Now, external auditory meatus is partly made of cartilage, partly made of bone. So, the external part or lateral part is cartilaginous, which is continuous with the pinna, and then we have the bony part. The bony part is attached to the bone, that is what you are seeing. The cartilaginous part you cannot see because that is with the pinna, that gets destroyed. Once you remove this pinna, you cannot see the cartilaginous part. So, this external auditory ear or external auditory meatus can be divided into two parts, lateral and medial. Medial one is the bony one, lateral one is a cartilaginous one. One is 2/3, one is 1/3, those things you have to know about. Then we have to talk about this piece of bone, this skinny piece of bone. We call them as styloid process. Now, this styloid process have got important relations to it. Now, we have a nerve which is coming from here and going to the lateral side to this particular bone. So, a nerve coming from the brain, from the posterior aspect of this and winging it laterally and going to the substance of the soft tissue structure which is present in here. So, in point of here we have a salivary gland present in here. What salivary gland we have? Parotid gland. Parotid gland have got three structure pairs. What are the three structure present in the parotid gland? Facial nerve, okay, retromandibular vein, and external carotid. These are the three structure that is present. Now, this neural structure that is coming through here and entering here. So, this is a neural brain structure which is coming here, entering to this substance, that is facial nerve. So, that particular facial nerve is present on the lateral side of this, that means external side of it. So, present on it going to these directions like this. Along with that, we have this external carotid artery, which is present in here related to lateral point of this thing. So, two structure that is present on the lateral side of it. One is the nerve which is going to the substance, and that other content which you are seeing here that we are mentioning, the external carotid artery. That external carotid artery also present on the lateral side of this particular bony piece. So, these are the two structure that is present to this particular lateral side of this particular bone, that you have to keep in mind, and easy to remember because you remember this. In front of that we have this parotid gland, and within this parotid gland we have three structure pairs. Two of them you have mentioned right there, and this retromandibular vein is related to more anterior in position. That is why this is not related to this particular bone. Retromandibular vein is ending from this cheek region and coming through this anterior aspect. So, this particular retromandibular vein is in anterior in position than that of posterior position. So, posteriorly it has two structure out of these three which is running through the parotid gland, this facial nerve and the external carotid artery, which is present on the lateral side relationship of this styloid process. Now, deep inside, if you go digging in, if you cut this and then you find a deep vein, which is present deep inside, we call them as internal jugular vein, which is coming from the sigmoid sinus coming from the brain. So, this internal jugular vein is present on the medial side of this styloid process, that means inside to it, and this lateral side or superficially it is crossed by this facial nerve which is crossing and getting in here, and this external carotid artery which is present on the side. So, two structure on the lateral side or superficial side, one structure to this medial or posterior to this particular or deep to this particular styloid process. This is what you are seeing here is styloid process, partly broken. It should be longer. This one is having a longer reach. This is a styloid process that you are seeing here, but this is again broken. It should be even longer. But anyways, you still have this particular styloid process. So, related to these particular structures that you have to keep in mind, what is related to the lateral side, what is related to the medial side. These are your exam question, because styloid process comes as a short note exam for it. Now, other than this styloid process gives attachment to three muscles of them, and all the muscles takes the name of the styloid, like stylohyoid, stylopharyngeus and styloglossus. So, to the tongue, to the pharynx and to the hyoid. From the styloid bone, they are projecting three muscles. So, these three muscles are attached to the skinny bone, skinny piece of bone that is present, they are attached to it. So, three muscles attached to this part we have to know. Other than this, we have two ligaments, prominent one is attached to it. Then again, they are related to the name also. So, styloid process to the mandible, we call them as stylomandibular ligament, and a stylohyoid is another ligament which is coming from styloid process to hyoid. So, these two ligaments and three muscles and two nerves or two neurovascular structures or vessels that are related to this particular styloid process. So, these are your exam high yield area that you prepare for your examination. Besides this particular identifying this particular bone, knowing this particular anatomical facts and identifying the different parts of this particular bone, and of course, the clinical significance, and of that this Pterion and Asterion, they are important, and Asterion and Pterion are the union point of that two are Pterion is more clinically important, and this mastoid process muscle attached to it. And what is a mastoid process? Is a kind of piece of bone which is hollowed or pneumatic. That pneumatic part we call them as mastoid air cells. That mastoid air cells through a tract communicating with this middle ear cavity, and this middle ear cavity we have a special separate class. We will talk to that particular mastoid part or communications of the mastoid part in the middle ear cavity, and middle ear cavity have got like walls, etc., etc., and that particular walls is kind of cavity within it. We have three bones, small piece of bones are present in here. We call them as ear ossicle, Malleus, Incus, Stapes, and we learned about that little bit about the development of that particular piece when you are talking about the branchial arch development as well. So, two of them we have just talked about. We will be talking other bones as well, which is coming from this particular the ear ossicles. So, this is a little bit about this particular temporal bone that you have to know the parts of it, the anatomical positions, and how to have this particular bone in normal positions as we are seeing this particular bones as we are saying. Now, coming to this particular part, a little bit of this as I want to say. So, this is you are seeing upside down. This is what I mentioned is styloid process, and this is what you are seeing here is tympanic plate, and this is the ear ossicle or ear opening, external ear. We are seeing here in front of that. This is a fossa for the temporomandibular joint, articular and non-articular. Two parts are there. This is the back side you are seeing here. This back part, what you are seeing, this region we call them the mastoid process. Now, and this is the zygomatic bone, zygomatic arch. So, this is anchored to the zygomatic bone. That's what you are seeing here. This piece, styloid process, have got like two structures related laterally. This is the lateral side. So, nerve and artery is related to the lateral side. Medial side, we have the vein, we call them as internal jugular vein. This gives attachment to ligaments, stylomandibular and stylohyoid. Three muscles, all are having same name, styloglossus to the tongue, stylopharynx to the pharynx, and stylohyoid to the hyoid bone. Now, out of that, this is what we are talking about. This point we call them as Pterion, and that particular area we have a foramen present in here. We call them as stylomastoid foramen. You see that this is a styloid bone and this is a mastoid, right? So, in between this we have a tiny opening which is present in here, right? So, this tiny opening we call them as stylomastoid foramen between the styloid process and the mastoid bone. So, we have a tiny opening, very small narrow opening, we call them as stylomastoid foramen. So, this stylomastoid foramen transmits the nerve that we are talking about, which is present laterally. What nerve is coming here to the stylomastoid foramen is the facial nerve. So, that particular opening where I place this particular the pinhead which is present in here, that is present on the lateral aspect, and in between the styloid process and this mastoid process we have this tiny opening, this one where I place the cursor here. We call this opening as stylomastoid foramen. So, this stylomastoid foramen you should be knowing and what transmits from that particular nerve. So, the stylomastoid foramen transmits a small tiny nerve. That small tiny nerve we call them as facial nerve. So, this is the stylomastoid foramen, and the general features of this particular bone we will be identifying it. So, individually this particular bone need to be identified by these particular parts of this particular bone: squamous part, mastoid part, petrous part, and the styloid process with a plate we call them as tympanic plate, and squamous part is above, mastoid part is down. Mastoid part which is projected posterolaterally, and laterally side we have this particular zygomatic process bone. Inside we have this particular petrous part which has two parts, apex and base. In between we have the body part of this particular bone. If you cut the petrous part of the temporal bone, you are getting inside the cavity of the middle ear, where you are going to find this middle ear ossicles. And in this particular external parts or external features, we have this particular styloid process. Styloid process have a tip and had a body and a base. The styloid process have got two structures related to the lateral side, one structure related to the medial side, three muscles and two ligaments are attached to it. And then posterior or in between the styloid process and the mastoid, we have this opening. We call them as stylomastoid foramen, transmitting the facial nerve from it. Facial nerve coming from the brain, getting inside. Once it gets out, then enters to the substance of the parotid gland. That's how it is coming. So this is all about this particular lateral view, and this particular place we call them as like the temporal bone. No deep digging is required, only know the general parts of it and the significance or holding this particular bone anatomically. And of that you have to know two muscle attachments that we have mentioned, which is related to the mastoid process. Of that, this particular squamous part, we have a muscle, we call them as temporalis, temporal bone, which is related to this, which is expanding to this part as well. So the temporalis muscle also getting to this particular region as well. But out here is important to understand here is that posterior belly of digastric and the sternocleidomastoid that we have to know. The foramen between this mastoid process and the styloid process, we call them as stylomastoid foramen. What comes through it, that we have to know, and this particular general features of this particular bone that we have to know. This part we call them as Petrous part. This part we have the apex, this part which is anchored base, then we have the body, and we have got foramens. This foramen which is present in here, we call them as internal ear opening or internal acoustic meatus. This one is external acoustic meatus. Internal acoustic meatus, I am bypassing it because we are talking about this particular meatus in a cross section class. We will talk about it later. So right now we are just focusing on these particular features. So you should be able to identify this bone, right side, left side, anatomically, parts of this particular bone, muscles attached to it, and styloid process. Prepare that as a exam short note, which is important to this particular bone, along with clinical significance as Pterion. What do you mean by the Pterion? And you understand this particular mastoid or mastoid process or mastoidal ear cells, and how these mastoid ear cells are prone to have infections. If you have middle ear infections, that means ear infection, how infection can spread to the mastoid bone and can create an infection to that particular area. Infection of the mastoid, we call them as mastoiditis. Infections of the mastoidal ear cells, which is lined by mucosal lining. And this mastoid is just like a pneumatic bone that we talked about, paranasal sinus. This is of course not a paranasal sinus, but is a kind of comparative bone thing which you see here. Alright. So see this particular bone, lateral extreme, see this particular bone anatomically. If you are able to hold this particular bone anatomically, keeping above, down, medial and lateral, and the directions will be this one which will be projected to the side, and this one will be directed medially. So whenever you are holding this one will be present in the back side, this one is directed towards the midline or should be crossing the midline, this is above, and this should be present on the lateral side. So this is easy to have this in anatomical position in normal when you are holding it, easy one, right? So have this particular thing directed toward midline, just like looks like crossing each other. So they should be going midline, this one toward the midline. So this is how we are holding it in anatomical position. External side, inner side, squamous part, mastoid part, the styloid process which will be going down, the zygomatic process, petrous part of the temporal bone, which is having together pectomastoid part joined together. They have got shallow grooves inside to it, inner face. Externally we don't have any groove such. The bony part, we have this external opening of the ear. This plate we call them as tympanic plate, which is thin plate, prone to have fracture if you have trauma to it. This particular zygomatic arch also have prone to fractures, and the anterior part which is making a union, we call them as Pterion, posterior part Asterion.